What if I told you that I had a solution to help with hair regrowth, facial rejuvenation, anti-aging, wound healing, and much, much more? If you like these topics, make sure you like and subscribe below. Hi everyone, I'm Dr. Mara Weinstein. I'm a board-certified dermatologist, and today we're going to talk all about exosomes. Exosomes are all the rage lately. They're being used widely across the spectrum of dermatology, orthopedics, and even some internal medicine for wound healing. Before we get into it, we need to understand what exosomes are. So taking you back to your microbiology days, exosomes are extracellular vesicles within a certain size range that have the capacity to communicate and signal to other cells. Exosomes also carry very important cargo. This cargo consists of proteins, ceramides, growth factors, and other things that cells might need in order to get reprogrammed, reduce inflammation, grow hair, heal wounds, etc. One of the essential parts of an exosome is the cargo that it carries. The third thing we use to define an exosome is the recipe. So exosomes are able to communicate with cells via cell-to-cell signaling, and in doing so, it's able to reprogram cells. So for example, if you are experiencing hair loss and the cells surrounding your follicle are damaged, it's able to help deliver a signal in order to reprogram that cell to tell it to, hey, let's regrow hair. So let's circle back. We talked about how exosomes are extracellular vesicles comprised of a certain size range. We also talked about how exosomes have cargo and a recipe. So the type of cargo that exosomes carry depend on the source of the exosome. Exosomes are derived from stem cells, and stem cells can come from a variety of different sources, such as placental tissue, adipose tissue, which is fatty tissue, platelets. It can also come from bone marrow and amniotic fluid. So there's a lot of different sources through which you can extract exosomes for use on human skin. Now, it appears when we look at all the different types of cargo that exosomes from different stem cell sources carry, we notice that the cargo from the Wharton's jelly age 0 exosomes, this is placental tissue, carry the most amount of cargo. And there's a chart here showing you all the different ingredients that these exosomes carry. So when you're looking to use exosomes to help with hair regrowth or repair a wound bed or deliver anti-aging benefits, you're going to want to choose an exosome that has the most amount of cargo. Now you might wonder, how do we get exosomes from stem cells? How do we get them in order to use on human skin? Well, in vivo, in the tissue, exosomes are created and secreted by these different sources of stem cells that we discussed. When they're secreted, the host cell captures them. So if you're applying them to the scalp, the host cell, which is going to be in the dermal papillae, for example, like a dermal fibroblast, is going to capture the exosome and use it to repair whatever damage is going on with that follicle. The captured cells then receive all the cargo from the exosome and have the benefit of that cell-to-cell signaling capability, and therefore the repair process starts. In the lab, Wharton's jelly, for example, is extracted from an umbilical cord, and then the stem cells from that mesenchymal tissue will be put on a media and cultured. The exosomes from those stem cells will be removed and then undergo a series of passes in order to duplicate them. The amount of passes matters too. So in some situations, there are multiple passes. With each pass of duplication and replication of stem cells, you risk having bad cells. When we're talking about stem cells derived from an umbilical cord, the mesenchymal tissue is extracted, and then the stem cells are taken and cultured on a media. The stem cells will undergo no more than 4 passages in this case. With each passage, the stem cells have the capability of differentiating. After they undergo 4 passages, in this case, the stem cells will secrete exosomes into the media. It's pretty fascinating stuff. At this time, there are many companies, both inside and outside the US, that are producing exosomes. And so when you're looking to get treatment with exosomes or purchasing exosomes, if you are a physician, it's super important to know some key factors when it comes to choosing the right company. So first of all, are the stem cells being ethically sourced and manufactured in the US? Do we know where they actually come from? This is a very important question to ask. Also, are they made in the US, and are they up to the FDA tissue processing standards? You also might want to know, what is the source of the stem cell? Are we using Wharton's jelly, mesenchymal tissue? Are they from plants? Are they from platelets? Are they from fatty or adipose tissue? Because all of this matters, like we talked about in the beginning. Depending on where they're sourced, they're going to have different different types of cargo. Another thing to ask is if they're lyophilized. That means that they're freeze dried in order to extend their lifespan. So if they're lyophilized, we know that can interfere with the functionality of the exosome, and therefore that's probably not the right type of exosome that you want to acquire. Also, because stem cells are from human tissue or plants, for example, they should all come with a CLIA lab certificate to show that they've been thoroughly vetted and checked so that they don't carry different disease states. When you get exosomes from a vendor, they should also give you a certificate analysis to make sure that they've been tested thoroughly by a third-party CLIA lab. The CLIA lab certification ensures that these exosomes are not carrying infectious diseases. As a board-certified dermatologist, I'm particularly interested in using exosomes for hair rejuvenation. Exosomes can be applied to the scalp in patients with conditions like androgenetic alopecia, which is inherited pattern hair loss, and help with hair regrowth. Exosomes communicate with other cells in the follicle to figure out what that follicle needs in order to repair and rejuvenate, and ultimately regrow hair. The end result we hope to see from exosome treatment on hair is increased thickness, increased density, increased follicle count, and actually a color change. So if when you're losing hair, your hair was sort of gray, when it grows back to your normal color. When applied to the scalp, exosomes are taken up by the dermal fibroblasts at the dermal papillae, and they deliver that cargo and start that cell signaling process to help repair the follicle and deliver the signals that it needs to regrow hair. To date, there have been a number of studies showing the benefit and efficacy of using stem cells for hair regrowth, and the data is just starting to come in, so we're hoping to be able to contribute to that. Here are some incredible preliminary before and afters that you can see using exosomes topically for hair regrowth. The process would be that the scalp is thoroughly cleansed, and then you use a device like a microneedling device to help create tiny little puncture wounds in the scalp through which the exosome solution can penetrate, and then you massage the solution into the scalp. We're only scratching the surface of this wonderful new tool at our hands. There's a lot of safety factors involved. There's a lot of boxes that need to be checked. We don't have all the data or all of the protocols lined out just yet, but it's important to know that it's coming, and this looks really promising. Stay tuned for more updates as I'm actively looking into this as a treatment and looking at the protocol for hair regrowth. Thanks for watching.